Hello, this video is on health and recovery during COVID-19. I'm Dottie, a nurse educator who's been privileged to join the groups at the Hamilton County Recovery Center, where we've learned many ways to protect our health during the so-called normal times. Now faced with a highly contagious disease, we're called upon to do what we can to stay healthy as best as we can during a new normal. Lack of face-to-face contact with family, friends, and peers might be preventing us from contacting and spreading the virus. But social distancing is also increasing anxiety and feelings of isolation, particularly for those who are in recovery. That's why we must do our best to maintain both our physical and our mental health. As Teddy Roosevelt once said, do what you can with what you have, where you are. As Dr. Fauci said, and he's our infectious disease expert, of course, just keep pushing. If you think you're doing too much, you're probably doing the right thing. If you look at these slides, Dr. Fauci wants to make America healthy again. And he tells us, keep calm and wash your hands, and science first. If you are young and healthy and have no underlying health problems, you're most likely to be in the majority who have mild to moderate symptoms and will recover without the aid of medication or hospitalization. This was the case with my 50-year-old cousin, who incurred mild symptoms, but unfortunately did not isolate himself when he was working as an EMT from my 84-year-old aunt. And she's the one who suffered with moderate symptoms and told me that her whole insides felt like they were falling out. As you can see from this slide, anybody who is an older adult and has underlying health problems has a severe risk, not only for having a greater chance of having complications from the disease, but also from dying. Since older adults have a poor immune response, it's important that we all do our best to protect them. This is especially true if you have underlying conditions such as diabetes, high blood pressure, chronic lung disease or asthma like I have, cardiovascular disease like I have, and severe obesity defined as a body mass index above 40. Complications such as breathing problems, strokes, and organ failure are more likely in these groups because they do not mount a good enough immunological response. So, if you have a health issue that puts you at a higher risk, make sure you're doing everything possible to minimize that. You should be especially careful to manage your condition with monitoring and taking your medications as directed. For example, if you have diabetes, your risk for contacting the virus isn't any higher than anybody else's, but you could have worse complications if you get sick, especially if your diabetes isn't well controlled. You should have a COVID diabetes plan. Since social distancing and shelter-in-place rules make it harder for you to get supplies that you may need, make sure you have enough food, especially the low carbs like vegetables, berries, and nuts. Simple carbs like a tablespoon of honey or a half cup of juice if your blood sugar dips. The maximum number of refills that you can get of your insulin and other medications. And also the phone numbers for your doctors and your health insurance companies. All important. It was Dr. Fauci who called the coronavirus a double whammy in minority communities, not only because of underlying health conditions, but also because of the health disparities and the difficulty accessing even basic necessities such as food, medications, stable housing, and health care. COVID-19 hits the poor hardest because immunity is compromised in poor communities who lack resources. Managing our health care during COVID-19 means practicing self-care. Connecting with others is most important for self-care, but we must do this by socially distancing with 6 feet between us. We have to keep that far apart. Connect while social distancing. Smile, nod. We're social animals, and we need to connect with other people. Social contact is so critical, even if our physical movements are restricted. So it's important for us to safely and regularly contact other people who are close to us. Make the most of even minimal human interactions by smiling and by waving hello, even if you are 6 feet apart. Smiling may be difficult when you are wearing a mask, but you can still wave hello when you're wearing your mask. This mask is particularly dear to me because it was made by my granddaughter for me personally on Mother's Day. My husband wears a regular paper mask when he shops for groceries, but for me, the sentiment is in this mask. It shows that somebody cared enough about me to want to see that I'm protecting not only myself, but other people that I'm coming in contact with. There are a lot of ways we can connect virtually, especially with the Recovery Center. The Recovery Center is there to provide you with support by way of phone, Facebook live streams, virtual support groups, and classes by way of the Zoom app. This is a great time to not only virtually connect, but to review what we learned in the groups at the Recovery Center. I'm going to be referring to the Recovery Center video for self-care practices in 2020 throughout this video, because it not only reinforces much of what we learned in face-to-face classes to stay healthy, but it also provides tips that will be useful during social distancing. And the most common self-care tip that was offered by the Recovery Center members in the video is get physically active and exercise. Basically, the message is sit less and move more. According to NAMI, exercise is an excellent stress reliever and mood booster. However, we learned in our wellness management and recovery class that while exercising is a great idea and can help prevent a relapse, you shouldn't overdo it. If you're talking about aerobic exercise, such as jogging or working out with weights, it's a good idea to have your doctor check you out before you begin. A 20-minute walk is a good place to start exercising. You can go out for a brisk walk so long as you keep your social distance. If you're healthy, mobile, and you live in an area where it's safe to walk, increasing your step count by walking close to home is a great place to start. Just make sure that you're keeping 6 feet away from other people when you're passing them. Also, gardening, working in the yard, or doing projects around the house can also increase your step count. If you do enjoy walking with your dog, then you want to avoid crowded areas like dog parks and busy trails. The quiet neighborhood streets and the less popular trails can give you an excellent opportunity to go out and relieve some stress and anxiety for yourself while giving your dog a chance to have some exercise and fun. Now, if you're into sports, then you have to be really careful exercising outdoors because something like basketball can be tricky if you touch the ball and you're breathing in each other's faces. It might be better if you choose something like running, biking, and tennis, but doing this with members of your own household is always going to be best, no matter which form of exercise or sports you choose. If you do nothing else to exercise, you can at least stretch. We learned in our weight and aerobics training that you can stretch while you're sitting or standing. You can use a towel or a stretchy band like I have. And all of this tension is going to be relieved in your neck, your shoulders, your chest, your back, your legs. So remember, if you do nothing else, the one thing that you want to remember is just stretch. You can get stronger by lifting anything. Jug of milk, cans of food, anything. Weight training is going to burn calories and make you stronger and keep you more physically fit and healthy. Eat right, eat clean. Proper nutrition and hydration can help you avoid the complications of COVID-19. Staying well fed is important for overall health. Proper hydration maintains proper blood volume and healthy mucous membranes that are better able to resist infection and tissue damage. Eating right was a tip suggested in the 2020 video, and we learned how to do this in our healthy cooking classes, and as well as in the habits that we adopted at healthy lunches that were planned and prepared for us at the Recovery Center. Remember that they always serve during a structured time frame. NAMI summarized this by saying that we should stick to a consistent mealtime and nourish ourselves with healthy foods. It's also fine to build in some comfort foods like hot fudge sundaes or freshly baked cookies. Although you may be tempted, this may not be the best time for you to start a restrictive diet. Stress was placed on washing our hands with soap and water at the Recovery Center, and we did this for a minimum of 20 seconds before we ate. Hand sanitizers were also readily available, so remember, not only do we eat healthy, we also eat clean. There is no current evidence that COVID-19 can be transmitted through food or food packaging, but it's possible for the virus to survive on surfaces and objects, reinforcing the need to routinely clean and disinfect all frequently touched surfaces, especially when preparing food or shopping. On a personal level, after my husband picks up the groceries, we leave our non-perishables in the garage for a day or two, and we wipe down all food packages. Access to food during a public health emergency may be difficult for some. If you are unable to get the food you need, reach out to family or friends for assistance. For example, for years I have supported family members receiving Meals on Wheels, but when the pandemic hit their Pennsylvania community, many of the delivery volunteers who were retired adults, older adults, feared becoming infected by the delivery. So I had to then turn to grocery delivery services from their local grocery stores. This was more expensive, but at least it was a viable option for people who had to shelter in place and were a very vulnerable population. Self-care tips from the Recovery Center members include getting quality sleep and getting more sleep. Both quality and quantity are important for the immune system. Everybody knows that poor sleep negatively affects mood and daytime functioning, so it's important to maintain good sleep habits through uncertain times. NAMI says if you are resting, try not to fixate on sleeping. Staring at the ceiling at 2 o'clock in the morning will just create a cycle of worry and insomnia. So if you find yourself lying in bed wide awake for more than 15 minutes, get up and change the mental channel by watching TV, reading a book, or listening to music. Also, it will be very helpful if you get up and go to bed at similar times every day. That's maintaining a routine. Regarding structure and routine, NAMI emphasizes the need for you to follow a regular mental health treatment plan. Make sure you always have an adequate supply of medication and take it as prescribed. We learned in the Wellness Management Group to maintain a routine, set SMART goals, and use little tricks to manage our illness. For example, To remember if you've taken your medication, you can every day use a pill box or a calendar. If that doesn't work, you could always ask a friend or a family member to remind you. Continue with your therapy appointments. Many practitioners are now offering teletherapy, either by phone or video, to comply with the social distancing requirements. Check with your healthcare provider to see if these services are available to you. I know that's what I use. I'm a great fan of the telehealth services. Now, telepsychiatry will eventually establish itself as a preferred mode of care for most people with mild to moderate mental problems, but it is not optimal for severely ill individuals who suffer from very complex psychiatric, medical, social, and economic problems that require face-to-face contact. There always will be a significant minority, though, who do not like, don't have access to, or can't use screens, but this fraction of the population will probably diminish over time. On to mindfulness. In the class entitled Study of Behavioral Health and Healing, we learn mindfulness techniques that use the senses to keep us in the present. These techniques include breathing slowly. Inhale, 1, 2, 3, 4, 5. Hold, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5. And also deeply sniffing something with a strong scent. At last year's recovery symposium, we mixed some lotion with a drop of essential oils, and we then used this to massage our hands. Lavender was the members' favorite scent, and on Mother's Day, when I was in isolation, I happily discovered a little lavender candle on my doorstep. Compliments of that granddaughter I told you about before, who feared risking my health with any face-to-face contact. She just dropped the goodies off with the mask, the candle, the mask, and was on her way. In a class entitled 21 Ways to a Happier Depression, we learned that comforting items could be found at the dollar store. One of my very favorites is a bamboo fragrance that I picked up at the dollar store. I love this for summer, and then I trade it out by trading it with the balsam fir when the winter holidays come along. But whenever you need it, you can, for $1 or so, pull out your favorite scent and remember that this will help you to stay in the moment and create the mood of mindfulness. Mindfulness is maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensations, and surroundings. In our gentle yoga and chair yoga classes, we learn to define mindfulness as paying attention on purpose without judgment. In yoga classes, we discover that there are alternatives for our attaining the benefits of touch during periods of isolation. They include exercises that stimulate the pressure receptors on our skin and self-touch with anything that causes the skin to move. We used a tennis ball during our exercises to self-massage the skin. Self-care tips from the Recovery Center members have included mindfulness, meditation, and yoga, all involving focusing attention on the present moment, rather than ruminating about a catastrophic, uncertain future, like with the pandemic. One of the biggest issues of being isolated from our typical social settings is that it triggers negative self-talk and sets us up for depression and anxiety. Mindfulness tempers those negative thoughts like, I should be handling this better, or this is unbearable. So we have to use self-compassion. And there are 3 components. Mindfulness is one of the 3 components of self-compassion. So the tip regarding mindfulness that was offered by one of our members was on specifically self-compassion as being the core feature when you have to stop, quiet your mind, engage the world moment by moment, and accept the experience, ourselves, and others. Self-kindness is the second contributor to self-compassion. Self-kindness is where you are gentle and understanding with yourself. It's a form of internal soothing, just like the external soothing that you do when you listen to uplifting music or smell the roses or pet your dog. Loving kindness meditation uses phrases such as, may I be safe and well, may I be healthy. Self-kindness can come from writing yourself a letter from the perspective of a loving friend or a relative. In this letter, we would use a very kind, compassionate, and understanding voice in writing to ourselves. In journaling classes, we learn to write letters to those who affected our lives positively or negatively on our recovery journey. The course goal was to write these letters and release all the guilt and shame and pain that we could let go of from the past and to live in the present. The third component of self-compassion is recognizing our common humanity. Now, this is when we acknowledge we are not alone. People all over the world are experiencing the impact of social isolation and depression, anxiety, and the tendency to feel disconnected. Masks can make speech unintelligible for many people with hearing loss, and by the way, I'm one of those, because masks will decrease the volume of a speaker's voice anywhere from 4 to 12 decibels. We should be aware of how important the gestures are then when people are wearing masks and how important it is to speak slowly, rephrase remarks when they have to be understood more clearly, and refrain from speaking when we are walking away from somebody. It's always face to face, and remember to use the gestures. In signing for recovery classes, we learn to communicate our feelings and our thoughts through these hand movements, facial expressions, and head and body movements. The CDC has released resources on COVID-19 in American Sign Language to go along with this. Respecting the special needs of people who are disabled, whether it be by hearing impairment or any other disability, is a way of recognizing our common humanity. In line with recognizing our common humanity, we need to help others, especially during hard times. So if you are able to, you can do things like offering support to people in your community who may need some help with their food shopping. Anything, however small it is good in making you feel better because you are helping somebody else to feel better. And then there's music. Make time to connect with the music you enjoy. It relieves stress and it reduces loneliness and depression. Social media is filled with people singing and dancing during social isolation. Even if you have a terrible voice like I do, sing anyway. It'll make you feel good. In the class called Media Madness, we learned through viewing The Soloist how our collective experience of recovery could be deepened by connecting with the homeless gifted musician playing a violin caked with grime on street corners and playing in a noisy tunnel. When the reporter, Steve Lopez, said, "Your violin has only 2 strings. You're missing the other 2." Nathaniel Ayers, a man who dropped out of Juilliard because of schizophrenia, replied, "There's a lot you can do with just 2 strings." Nathaniel's goal in life was to figure out not only how to replace the strings, but to arrange notes that were scattered in his head. In spite of his circumstances, his music was proof of his strength and resiliency, so important during these troubled times. Engaging in visual art enriches your recovery. As you focus, relax, and express yourself, it reduces stress and improves overall well-being. Recovery Center classes in basic drawing, clay, and sculpture, and watercolor have provided us with a place of refuge where we could slow down and engage in the present. During my daily walks during this pandemic, I reflected back to this class that I took in basic drawing, where we experimented with what we called value, and meaning like the lightness and the darkness of an object. On sunny days, I now look for patches of light and shadows that come together in an ever-changing pattern in the grass and on the pavements. I find this very relaxing in a time of turbulence. One self-care tip was turning to crocheting as an art form, since it offers infinite opportunities for creativity. Counting the movements of hooks and needles, row after row, cultivates patience, focus, concentration, and persistence in creating something you make with your own hands. Crafts like crocheting and knitting also provide stress relief, as you can lose yourself in a simple, repetitive activity during a time of isolation. Handmaking greeting cards is another craft that could really help you relieve your stress and connect with others during the pandemic. Modeling your own handmade cards for others based on the beautiful ones that we could once purchase at the Recovery Center is another way of creating and also communicating with others to celebrate birthdays, holidays, while you are isolated. A tip received from a Recovery Center member was being more independent and protecting myself. So how do we do this? The Assertiveness and Self-Empowerment group taught us that any change, large or small, is challenging, and we need to be prepared. The first thing we do is to ask ourselves, what's the worst thing that could happen? Then, what's the probability that could happen? And what can I do to prevent it or lower the probability? Next, we tell ourselves daily, I can and I will express my feelings, ask for what I want, and say no to what I don't want. This is called assertiveness. During this COVID-19 crisis, it's important to be safe, be strong, be prepared, and be well. Be yourself. Accept yourself. Value yourself. Forgive. Express yourself. Trust yourself. Love yourself. And most of all, empower yourself. We have learned in Recovery Center classes that we must take control of our lives at every level. The pitfall of personal development advises us to do the right thing, even when everyone else is doing the wrong thing, like not protecting our most vulnerable during a pandemic. As he says, expect the best, but be prepared for the worst. Speak up for yourself, take a stand, and refuse to accept less than the best from others or from yourself. Keep pushing. We will persevere and make it through these difficult times together.